So let's talk about allergy testing, and there's three main forms of allergy testing available for us, and that is skin prick testing, blood allergy testing, and oral food challenges. I might start off by talking firstly about skin prick testing and blood-specific IgE testing because they often correspond quite nicely with each other. So this is what I would say is the indirect way to measure food allergy. Okay, we don't want to cause a reaction. We suspect that a child may have peanut allergy or cashew allergy, but we are maybe 80 or 90% sure, but we don't want to cause a bad reaction by giving them more peanut, and we want to measure it through an indirect measure. There's many different ways to do skin prick testing. There's many different devices you can use, and there's many different type of extracts you can use. So we can use the commercially produced extracts. We can also use sometimes the fresh foods, and because the sensitivity and accuracy differs. So to give you an example, maybe 10 years ago we used to use the cow's milk extract from Holistically, which is a company in America, and now in the last 8 to 10 years we've been swapping across to fresh milk because the predictive values changes a little bit, and when we find that we're missing some allergies which are important, then we switch across to a different allergen. Another typical example of a food so most foods that we usually use the fresh allergy testing for is fruits, vegetables, fishes, and some of the nuts don't perform very well on the extract. So beware of device, type of extract, is it standardized, and because that can actually influence what the result shows. So what happens is the allergen is scratched onto the back of the forearm, and then we wait for about 15 minutes before measuring the wheal size. So